Can you hear? Trudy Hill, can you hear me?
See, ask her to type it in the chat.
Type it in the chat if you can.
I hear you.
Good morning, everyone. Can everyone hear me? Yes. Okay, my name is Gene Kimball. I'm the Deputy Public Affairs Officer here at Dole VA. And welcome to our Veterans Town Hall live again. It's been a number of years since you've all been invited into the facility for these town halls, so we've been doing virtual. I've heard from at least one person who says she's really glad that we're back to live and not doing virtual. So hopefully this all works out well for you and for those online. We are doing hybrid today. So people who were not able to come in are able to jump on Teams and watch the presentation. We're going to provide some updates this morning on programs and services that are provided here at the Dole VA. But first, we want to hit some housekeeping issues. So next slide, please. Today's session is being recorded. So that those people who are not able to be here and who cannot log on during live, be able to watch it at a later time. That meeting will be on the hospital's website later today or tomorrow morning. If you have questions during this session at any time, please try to hold those off until the end. We try to do all of our presentations so that everybody has the ability to give their presentation with leftover time at the end so that we can answer questions at that time. If you're online, please try to do that. Please try to put your questions in your chat, and we will answer those as we can. When asking questions, please refrain from sharing personal information as we are live. And so we don't want you to provide personal information in PHI or that friends or colleagues or other veterans. One thing that we would like to do since we are live is if we could do the Pledge of Allegiance this morning. I will start us off and stand. I pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all. Thank you. One other quick housekeeping note. Restrooms have been expanded here and made much nicer than what they were prior. And they are back here. Dr. Cotton is over here clapping. So they are back in, you're standing where I'm standing, they're in the back right corner. So both male and female restrooms are back there. So next slide, please. We're going to go ahead and get started today. Mr. Michael Payne, who is our Center Director, is here to share information about some new programs, or not some new programs, I'm sorry, some programs that he feels are really important to discuss at this time of the year. So Mr. Payne, the floor is yours.
Hey, good morning, everyone. Good morning, everyone. Good morning. Can you hear me now? Yes.
Yes, sir.
All right, perfect. So I do have a few updates, but first I wanted to say thank you. Really good to be in this space. It's good to see everybody. So it's weird looking around the room, considering that I'm not looking at a screen as I was typically looking at in my office. So thank you for all those that braved the cold weather to come out and receive some updates from us. Thank you for your service and your continued commitment to veterans and just the work that you all have done to support our nation. So we are hoping that we find this space more accommodating. I am not familiar with the old space, so I'll be very candid and say I have no idea what the old space looked like. I'll just tell you that this space probably looks a little bit better. I think it's a little bit bigger. Probably, I'm hearing that the bathrooms are a little bit better as well. So I hope that you find that great. So before we get started, let's go to the slide, please. I wanted to give a few updates on some of the programs that may not be new, but you may be familiar with these. But I wanted to share a few updates regarding some progress we've made with some of these things. So again, thank you for joining us, and I'm hoping that you all had a great holiday season. So very quickly, I wanted to let you know that So we had a very successful year in 2025 at the Robert J. Dole Medical Center. We were successful in many ways, but a few of them are highlighted. A few of those were more public-facing accomplishments, and a few of those were more internal to our system. So the first item, and I'll look behind me just to make sure that I'm on the right slide, is the update on our Centers of Medicare and Medicaid Services, or what we refer to as CMS here at the VA. So we had a successful accreditation survey by the Joint Commission, and the Dole VA in our Wichita community was named the #1 city in America for veterans care. And so what does that mean for you as a veteran? That means that you should be thrilled about the level of care that you will receive at your VA medical center, and that the providers, the nurses, the clinicians, and the staff are all really committed to ensuring that veteran care and veteran quality of care is in its highest regard. And so I could not be more proud of our staff and those that support you and our fellow veterans when it comes to receiving world-class care that you've all earned. So thank you all for being a huge part of that. If it's not for your feedback, if it's not for the comments and concerns that we receive, we would not be able to share in those accomplishments. So we will never stop striving to improve the way in which we serve you, our veterans. Next slide, please. All right, this slide talks a little bit about things that I also feel strongly about, which is we acknowledge that we're coming out of a holiday season, and while the holiday season is really rewarding for many, there's feelings of grief and anxiety and concern for other veterans. And so we want to be sensitive to that. We want to ensure that we provide resources for our veterans that may be struggling after coming off of a long holiday. And so we wanted to take a few minutes to talk about our suicide prevention efforts here at the Dole. So at the VA, this is our highest clinical priority. And that's regardless of where you are in the country, which VA you're at. The Secretary of the VA has deemed this as priority 1 for veteran care. And so at the Dole VA, it's also our highest clinical priority. I want to be clear up front. And suicide prevention isn't a job for just one person or just one team. It takes us all. And so we challenged our staff here at the Dole to really prioritize how we allocate resources to preventing veteran suicide. And we challenged our staff to prioritize how we message and market the suicide campaigns that we have throughout the year. And suicide prevention is everybody's business. And so it's really important for us all to share information and to share in conversations with our fellow veterans that might be struggling as we come out of the holiday season. And so there's no specific warning sign, but it takes a village to acknowledge that anyone struggling is challenged to reach out to anyone in our healthcare system, whether that's someone in the hallway, cleaning, whether it's an environmental service employee, whether that's a nurse, whether that's a provider, whether that's a medical support assistant, checking you in your appointments. We all own the responsibility to prevent veteran suicide. It doesn't take just a leader. It doesn't just take clinical staff. It really is one of us all to improve us. So, great. Let's go to the next slide, please. So another very critical priority for the VA is preventing veteran homelessness. So anytime we hear suicide prevention, prevention of veteran homelessness, that should be a very great concern for us all. Those words should never be in the vocabulary of any of us. A homeless veteran is never a sentence that I want to hear us talking about. It's like a suicidal veteran. But unfortunately, we're faced with challenges in that regard. And so we have programs to help support. So coming out of another holiday season, it's really important for us to remind ourselves that financial pressure, grief, loss, loved ones, etc., all lend itself to not just suicide, but homelessness. So here at the Dole, we're on a mission to ensure that all of our homeless veterans are housed, that we know each of those individuals by name, and that more importantly, they all know that they're welcome and accepted here at VA. We won't stop pursuing that until every single veteran within our catchment area is outreached, that they have the resources, tools that equip them for a sustainable life. So we want everyone to know it's not okay to be alone during difficult seasons, and that we here at the VA are here for them. So at our medical center, we're fortunate to have a really strong locally based suicide prevention program, but we're also really fortunate to have a team of social work service staff and others that are committed to ensure that each of our veterans in our community are out. So we won't stop pursuing. So that team is led by several of our social workers. We have Ms. Esther Donados, Mr. Cody Beaton, and Ms. Regina Parra. They serve as subject matter experts, and they work with providers, staff, and veterans each day, preventing homelessness and suicide. So thank you for helping us partner with this. So next slide. But before we go to the next slide, let's talk a little bit about point in time count, because I didn't know if it was on that slide or not. So our point in time count is going to come up this month, or next week, if I'm not mistaken, where you actually, can you hear me now? I think that's a little better. It's going to come up next week, and we plan on having several of our staff that will be available for that. I'll be attending that, as I do typically every year. And that is an opportunity for us to go to the community. That is an opportunity for us to go out and outreach every single one of our veterans throughout the Wichita catchment. So we look forward to that particular event every year, not just because we get to go out in the cold weather and brave the cold weather, but because we get to find any particular veteran that hasn't been housed yet. So we look forward to that next week. We also look forward to your participation if you feel inclined to come support us. It's a voluntary event that's open to everybody. So you can sign up on the website, and that information may be there. If not, we can get that to you. And we hope to see you there.
Better to come full.
Okay. Next slide, please. There's my last slide. Okay, great. So that's my last slide. And I want to pause for a moment for any questions, comments, or concerns for the updates that I just provided. Yes, sir.
Where do you house the homeless veterans?
Where do we house homeless veterans? Throughout the community, actually. And I don't know if some of our social work service folks want to address that specifically, but we have a team of social workers that typically work with a badge program, and we have contract vouchers to house veterans either at local sort of shelters in the community. There's transitional housing. There's also hotels that are available as the need comes up. But typically it depends. It depends on that veteran's particular needs. It's housing will look a little bit different for each of us, but we strive to house them at the point. So we want to put them in a sustainable housing option, but sometimes traditional housing is the first option they'll be decided.
Would you happen to know how many veterans, homeless veterans, that you're housing at this point in time?
I don't want to guess, and so I'll say I'll take that one for the record. How about that? I know we typically have a specific number each year. I don't have it in front of me, so I'll get back to you on that, sir. Unless someone in the room or on the line has that specific response rate.
I can say, I know we currently have over 300 vouchers that we're managing, and each voucher allows us to house a veteran. So over 300 that we're working with in our caseload.
Really?
Yes, sir.
That's impressive.
Thank you. That team does great work.
Thank you, Dr. Kyle. Great question, sir. But we'll certainly get you that specific number as well. So I don't know if Kim Barker on the call or not. I thought we could answer that too. Yes, sir. We got another question?
Is there any, and again, just a thought.
Yeah.
are there any statistics as to male, female, veteran homeless that's being cared for now?
That is another one that I'll phone a friend on, so I don't have the specifics on like breakdown, 60% male, 40% female, but that's certainly something that we can circle back to you on, and I'm sure that that's in the, dig into the data and find that out. My inclination says that the number is probably higher for males than females, just because we typically serve a higher male population of veterans than female veterans. But I wanted to speak, so I'll take that back for the records. Great question. So thank you, sir. Unless someone in the room was a lot smarter, I think the opinion has that data read over his back. Okay. Well, maybe someone will call me out of this one. Anyone type anything in the chat? I have no idea what's going on the call, so I can't see.
We did have a question about privacy, sir. One attendee said, like, issues with the practice of having the veteran's full social security number on medical bracelets and labels when a veteran is in the ER or admitted to the hospital. Nurses also ask for the veteran to say their full SSN out loud occasionally, rather than just giving their date of birth and possibly the last four session.
Yeah, so that is a great question, but I'm going to defer to either Dr. Moab here or Dr. Cotton. We really just got challenged on that during our most recent joint commission survey, probably 3 or 4 months back. And so I'll defer to them for a more specific response. So when you want to take that?
So I can say that we certainly understand that concern, and we do take a lot of steps to ensure that veteran information is not, that we protect it. So we do have a process for shredding documents, for shredding and removing wristbands and lab labels. I'm not aware of any other way for us to print wristbands and labels. The survey that Mr. Payne was referring to does require us to use 2 patient identifiers. I definitely agree that the date of birth may be a better way than the full social. And I'm sure you all are already aware we do need the last 4 to access our medical record and ensure that we have pulled the record up of the correct veteran, but for identification, we can use the full name and the date of birth.
Thank you, Dr. Cotton. And Mr. Hunterville, can you ask if they were able to hear that response, or should we type in a response as well to follow that up?
She was able to hear, sir.
Okay.
We're going to follow up answers. I've got it.
Okay. Thank you, Dr. Cotton. And I don't know, Dr. Moore, do you have any more to add to that?
I think nothing to add, sir. I think Dr. Khan covered it.
Okay, thank you. Great. All right, what else, Mr. Hunter? Are there any other questions in the chat? And then I'll go around here to the room as well.
No, sir, no other questions in the chat.
Okay, so then we'll turn it back over to our veterans that are in the room. Are there any other specific questions regarding the updates on suicide prevention, prevention of veteran homelessness, but just the general updates that are provided on sort of our accomplishments for FY25? Yes, ma'am.
In the VFW magazine, different VAs had talked about sponsoring, not VFW, but VAs had the tiny homes. And I was wondering if the VA here had any of those types, the tiny homes for veterans.
Yeah, so the question was regarding the modular homes for veterans. I am not aware if we are planning on purchasing any of those, at least for our VA, not immediately, but that might be something that we can explore later. We certainly are always looking for options to provide transitional housing for veterans that are coming out of homelessness, or that just maybe there's some difficulties in life. And so that may be an option to explore over time. Yes, I agree that those are becoming very popular in the Western states. And they're very cost effective, especially compared to traditional sort of single story or family. So, great question. Yes, sir.
Kind of all, but what is it?
Want to explain?
Oh, I'm not sure,
Oh, okay.
but they're actually, yeah,
So,
it's supposed to be a home. It's, so it has all the amenities and
So it's not.
it's more than just,
It's not a problem.
yeah, I don't know if it's more than one room, but it's got everything in that room.
so there are several different options for the modular homes. I mean, some are just made out of like typical material or purchase a home with your trailer, something like that. There's some sort of a configuration with wood, different types of hardy plank homes. But ultimately, they typically are smaller, couple 600, 800 square feet or so. Some of them can even go up to 1,000 square feet. And they typically provide home accessibility for 1 or 2 bedrooms. And so they have a bathroom, you typically have a couple of rooms, you have some space for a kitchen and things like that. So typically what you would experience in, sort of a dormitory style room that's very different.
Yeah, I just.
Yes, sir.
It's in my mind, it's not just.
Yep. So, great question. All right. Any other questions? I know this is our first time doing this in the auditorium in a long time, so I probably messed up the flow a little bit because we still have several presenters that are coming after me. But I did want to miss the opportunity to at least take a few questions and share in some of the experience. So we'll stay here as long as you need us to, is the point. All right, so I don't think there's any other questions. I'll peek in with Mr. Herndon one more time to see if there's something else I'm missing in the chat. Before we turn it over.
There is another question, sir, but it's fairly broad in nature and it is from an employee, so we'll address that directly with him.
Okay, great. So then, before Ms. McClure comes up, though, I feel like I was highlighting some of the accomplishments for 2025 and talked about some of the things that the team has done. But I don't know if I shared that our team earned another 5-star rating in FY25 as well. So that's our 3rd consecutive 5-star rating that we've received in the last 3 years for the Center for Medicaid and Medicare Services. So why is that a big deal? Because that's the highest level of rating you can obtain as it relates to quality, safety in the healthcare system. So really, our team deserves that credit, not necessarily the people in this room, but it's the people out on the front lines that are delivering care as we speak. Those folks that continue to commit to prioritizing veteran care each and every day. So while we are rated the #1 city for veterans healthcare, we're rated with all of these different 5-star ratings. We also know that we have opportunity to improve. And so we always like to challenge ourselves in our healthcare system to never get complacent and to never rest on our laurels, so to speak, because we know that there's always more to improve upon, but we also know that every veteran doesn't get the experience that person, that 5-star veteran would be receiving. And so we want to reach those veterans as well. And so every single veteran, I want you to hear this. If you are not satisfied with the level of care that we're providing at our healthcare system, if you are not satisfied with the experience, if you're not satisfied with the hospital quality, if you're not satisfied with the cleanliness, then you have an obligation to please come and speak with me. You can send me an email, you can send me a text, you can send me a phone call, and I'll leave my information with you after this meeting as well. And we genuinely mean that because every single veteran deserves 5-star care, quality of care. And if there is one veteran out there that's not receiving that, or their perception is not of that with 5-star quality, I personally want to know about it. And so please continue to share that information with me. Please continue to share it with other executive leaders. We have several of them in the room right now. And if they're not in the room, we'll get some information so we know who those contacts are as well. So thank you all for your continued commitment to choosing the VA because we know you have a choice. You don't have to choose us for your health care, but you do choose us. So we thank you for that and we never want to take that for granted. So Ms. McClure, over to you now.
before Alicia gets started here, I just wanted to kind of follow up on something Mr. Payne said, that CMS 5-star rating is pretty important and it's impressive. The CMS 5-star rating isn't just a VA rating. The CMS 5-star rates all hospitals that are CMS. So, you know, here in Wichita, if you're looking at Wesley, being Christie, Kansas Heart, any of those hospitals, they are included in that survey. So we are rating a 5-star as compared to not just VA hospitals, but all hospitals. And as Mr. Payne said, this is the 3rd year in a row that we've gotten a 5-star rating. And I believe that we're one of only 18 VA hospitals in the United States that has done that for 3 years in a row. So know that Dole VA is doing as best it can. And as Mr. Payne said, we continue to try to do even better. But I feel comfortable that you're getting good service here at Dole VA. Kind of along those lines, we are always looking to improve. Next slide. No, there we go. Just Alicia. We're always looking to improve access to services for our veterans. And we have a set of initiatives that we call ACE, ACE initiatives. And Alicia McClure, our group practice manager, is here to talk to you about a couple of the different things that we've done to improve access for our veterans. And so Alicia, leaders.
Well, good morning, everyone. It's still morning, right? For a few more minutes. Anyhow, I'm Alicia McClure, the group practice manager, and one of my major goals here at the VA is improving access for veterans. So that's what I spend a lot of my time on, and so I'll get to talk to you a little bit today about the ACE initiative, which stands for Access, Choices, and Excellence to Veterans. So the ACE initiative, for those of you who don't know, it is enacted by an executive order, and that executive order it was called Keeping Promises to Veterans and Establishing a National Center for Warrior Independence. And basically, it is looking at spearheading some enterprise-wide changes for the VA. How do we look at the VA as a whole to improve access and look at all the individual services that touch on improving that access for our veterans? So next slide. So I'll do a little update. I have given some information on ACE in the past, so I'll do an update on some of the initiatives that have already happened and then some of the initiatives that are still in progress for more to come. So next slide. So one of our initiatives was implementing some clinic practice management strategies. And one of those strategies was using a program called Open Slot Management. And Open Slot Management is a program that allows veterans to accept an earlier appointment if an appointment comes available within a service. It's a text-based message that goes out to alert a veteran an earlier appointment is available, and they can choose to accept that appointment or not. That really helps us counteract those clinic cancellations and things, and it reduces the time for the clinical staff to have to call to find a veteran to fill that slot, right? So it helps keep everybody gainfully employed and definitely increases our access for our veterans. So I put a little snapshot of where we were in FY25 and where we are now in FY26. So compared to FY25, we are on track to send over 50% more messages in this program, and then reschedule nearly 50% more appointments. So we're adding clinics and services to this program all the time with the goal of improving access as much as we can. And then you can also see compared to FY25, we've got a little more buy-in from our veterans. So we have a 1% higher reschedule rate. So veterans choosing to make that choice for that early appointment. So next slide. Okay, so another one of our clinic practice management strategies was to reduce no-shows. As we know, no-shows do contribute to decreasing our access for veterans. And so across the nation, we're actually seeing a lot of success. And so you can see the national average up there for FY26 to date for the nation is even lower at 7.9%. And then here in Wichita, we're at 7.0%. So we're doing a really excellent job in decreasing those no-shows, and a lot of it is in part to veterans. So there's a lot of messaging going out to our veterans about how to cancel their appointments timely so that we can fill those slots. But then a lot of work internally on the support staff to ensure that veterans are getting their appointment calls and their reminders and all of those things that we can do to reduce those no-shows. Next slide. Okay. Another clinic practice management strategy that we implemented was called clinic profile reviews. So in the VA, we have hundreds and thousands of clinics that we schedule patients into. And so the goal is to make sure that your clinics aren't duplicated, that providers have the right amount of slots in their clinics to schedule those veterans. And so we are working across the board. You can see compared to the national average, where the scheduled utilization is around 54%. That means they're filling their schedule, about 54% of their schedule. So Wichita is filling about 78% of their schedule. So quite a bit more. And the difference between the scheduled utilization and that actual utilization is that no-show rate. So those do lower our utilization a little bit of our clinics, but we're working really hard. And hopefully by the end of the year, we'll be back up above 80%, which is where we like to sit. And that ensures that we're not too full to take care of those veterans who have more urgent needs, but also that we're using our access appropriately. And then, yep, perfect. So our next strategy for CPM is to reduce our clinic cancellations. And these are cancellations directed by the provider, not the veterans. So our goal is to ensure that clinic cancellations are done more than 45 days in advance. So we give enough notice to our veterans. And so nationally, we're seeing a percent of grids canceled within 45 days at 9.1%. And here in Wichita, we're at 8.4%. So we're showing some really good improvement over FY25. And my mouth is so dry. I went into the kitchen. What I saw used to be the kitchen. Can I see this? I'll see this. I'll see this. Wait, I bring up for patient.
But you must try to get away.
No, my. Thank you. Okay. All right, another CPM strategy we have is stat consults. So stat consults are consults that are needed for urgent care for veterans. And so in the military, we like to think of life, limb, or eyesight, right? So those are consults that are needed for care within 48 hours. And so the goal is to provide that care and complete that consult within that 48-hour time frame. And so in general, we have seen a reduction in the volume of stat consults, and that's due to providing some more education. What really is a stat consult? You know, typically physical therapy is not something that you would order stat, but maybe a cardiac stress test might be something that's more urgent for a veteran, right? And then the average hours to close those consults, you could see, has gone down pretty drastically, down to about 12.8 hours so far through FY26. So that shows that not only we're receiving those consults timely, but we're also providing the care and getting that documentation back in order to close that consult in a very short amount of time. So that means our process is working. So next slide. So another thing that we're working on is our mental health telehealth offer. So ensuring that when telehealth is available, that we're offering that option to the veterans so that they can make an informed choice about their healthcare and how they would like to receive that healthcare. And so compared to where we were in FY25, we've had quite a significant difference in ensuring that we are ensuring that telehealth is appropriate for a veteran. We're documenting that. And then we're also documenting that we offered those options to the veteran, and then also reporting that veteran's choice for that. Next slide. And then this is another initiative that we're working on called the view alert reduction. So view alerts are notices that go out to providers or other clinical staff about veterans. It could be a lab alert, your lab results are back, or your test results are back, or hey, provider, I talked to this veteran today and they want to be seen in podiatry, and they're alerting the provider to that instance. And so in August of 2025, they established our baseline for these alerts, and Wichita was receiving 1.1 million alerts per month. That's a lot. So that actually amounts to 38 alerts per month per enrolled veteran. Even though we may not see the total volume of enrolled veterans each month, we're still getting that many alerts. That's a ton, right? So our goal was to reduce those alerts that are unnecessary and to make sure that clinicians can focus on what is actually important for the veterans and be able to give those test results timely and address those things that are concerning. So we're looking at some of our processes that are causing duplication or things like that to reduce those alerts. So our goal was to decrease by August of next year by 10%, and we've already reduced ours by 24%. So just getting rid of some of those automatic notifications that are going out every time a consult is touched along the way, things that aren't necessarily assisting with helping our veterans. Next slide. Okay, decreasing wait times. We know this is always a goal for us. So our internal goals are our primary care to be provided within 20 days, as well as our and then our to be provided within 28 days. And it does fluctuate a little bit during the holiday time. Less veterans want to have care before Christmas or Thanksgiving, right? So our wait times do get just a little bit longer. But for primary care, Wichita was at 18.9 days, national average about 26.7 days. And then general mental health at 16.8 days and national average at 17.1. And then specialty care at 28.3 days and the national average of 40.9 days. And then for community care, our goal for community care is to schedule those consults within 7 days. That's a very lofty goal because they're doing a lot of communication with those outside facilities as well as with the veteran to connect to try to get those appointments scheduled. So the goal is to schedule less than 7 days. Wichita's wait time that was reported last month was at 22.73 days, but we do average around 12 days generally. So we had a little bit higher wait in the month of December for this data, and national was at 27.81. So it's definitely something we're working towards. It is a lofty goal to get under 7 days, but we'll get there. Next slide. Okay. Maintain or add same-day services or extended hours. So Wichita is continuing to offer same-day services in primary care and mental health. And then we also have some services that do take walk-ins, like optometry and audiology as well. And then we do have some extended hours that refers to hours outside of the normal business hours. So we do offer appointments before 7:30 and after 16:30 and on the weekends in some of these services. And then, so the extended hours are primary care. They have weekday and weekend services and women's health and mental health services. And then we also have several specialties that do offer some extended hours like audiology and I believe the eye contact as well. So, next slide. All right, reduce unused RVU capacity. So we want our RVU capacity less than or equal to 6%. What this means is how productive are your providers? Are they performing at the productivity target? And if they're not, how much do they have to improve to get to that productivity target? So we want them to be 6% or less, to reach that target. So what they do is they compare our size and complexity of our facility to the national average. And then they base those standards for each facility based on how they rank. And so our unused RVU capacity for Wichita, we sit at 3.4% right now. We ended the year last year at 2%, which is pretty fantastic. And so we hope to continue to improve that as we go throughout. And national average right now is about 9%. So, next slide. All right. Improve BMI consult processes, best medical interest. So this is another initiative. The Elizabeth Dole Act provided some improved clarity on our best medical interest. So the eligibilities were initially granted by the Mission Act, but this is when a provider and a veteran together decide that their care is best provided in the community for a specific reason. And when that happens, the ACE initiative requirement or goal is that there's no additional review that happens to prevent that care from going to the community. So we want to streamline that effort so that there's not an interruption in that veteran's care if it is decided that it is in their best medical interest. And so we're doing some audits now at regular intervals, and we'll have more information about this one in the future. And next slide. Okay, expand veteran online self-scheduling. So another choice for veterans. So this is an opportunity for veterans to select their own appointments in certain services or request appointments in certain services through our online portals. And so this really will improve our timeliness to care with veterans being able to make these choices. And so in the past, that VEOS is the program that is called Veteran Online Self-Scheduling. It was previously enabled in one of our primary care clinics and one of our mental health care clinics at each site. And so now the expansion is going to require that it's one PACT clinic per PACT member. That means for every PACT team, your RN clinic, your provider clinic, your social work clinics, your clinical pharmacist, you'll have access to self-schedule in any of those clinics. And then there will be a general mental health clinic, a substance use disorder clinic, and a primary care mental health clinic enabled at each site. And then there will be also some options for some of those services that are considered direct scheduling services. So amputation, audiology, general clinical pharmacy services, and social work services. And then there will be some options to request services for CPAP and home sleep studies. Next slide. Another effort is to expand our external provider scheduling. So this is a program that allows us to link to a community care provider's schedule and physically schedule our veterans into their appointment slots, which cuts down significantly on our time to schedule, right? So the goal is to get more providers enrolled in the community. The more you can get bought into the system, the more grids we have access to, the more we can improve our scheduling processes. And we can make that just a one-stop shop with a phone call to the veteran, offer that appointment at the same time, and we don't have to worry about coordinating with that other medical center. So it will definitely improve our timeliness. So far, we've averaged about 18 appointments scheduled per week in the month of December. And we have a few services that allow EPS right now, but we find that typically the more providers that enroll, it kind of snowballs, right? They catch on to it. They find that it reduces their administrative workload, makes life easier. They still get to review the consults that come in, right? And so they'll catch on and we'll get more in the future. Next slide. Oh, that was enough. That's a lot that we're working on constantly, and there's probably even more to come. So what questions do you guys have for me? Yes, sir.
Do you have any data? I'm seeing more and more veterans coming from Oklahoma City up here for services. How does that affect the strain on our primary care doctors?
Yeah, so I don't have a specific number, but we are seeing an influx of veterans from Oklahoma. A lot of them choose our Carson CBOT to go to, and a lot of them do get care here in Wichita. We do provide care because we're so centrally located in the United States. We actually provide care to a lot of traveling veterans, and we have a traveling veteran program to assist those veterans that are just traveling through Wichita to get care while they're here and then move on to their next location, right? So a lot of truck drivers pass through Wichita with all of our major highways and things like that. So we do have a lot of programs in place, and I think Dr. Malott also had some input he'd like to provide.
Yes, I just want to add, I'm Dr. Mawad, Chief of Staff. Wanted to add that we started a new PACT team. PACT is Patient Allied Healthcare Team in Primary Care. With Dr. Tammy Nelson being the provider to open some capacity for veterans who enroll in our system from Oklahoma or from anywhere else. So Dr. Tammy Nelson's team is growing rapidly, but we still have capacity to accommodate in primary care for the new veterans who will enroll with us from Oklahoma or any other state.
And every year we're evaluating our enrolled veterans, our volume of patient care that we're receiving, and looking at those statistics to determine if we have the right volume of providers here to provide that care, or how we need to grow in the future in order to accommodate. Does that answer your question?
Yes.
Okay. Anything else? Anyone online?
I have covered all the questions online.
Okay. Yes, sir.
You know, I mean, like if a veteran goes overseas, Europe, or wherever, they need to go to, is there any interaction there? If you don't know, that's fine.
Yeah, so I don't know of the specific programs, but there are a lot of programs where veterans are still receiving care. Like we had a veteran last week who is in Peru and is meeting with his primary care provider virtually to provide that care and provide him with his prescriptions and medications. So we do have lots of ways to reach our veterans, but I can't speak to the specific programs. Okay, thank you guys.
Thank you, Alicia. Appreciate that. Next up, we're going to talk about travel pay. And if you remember about 6 months ago, I think Charles and Pat and our chief got up and talked to you about some changes that were taking place in travel pay. And if most of you are probably, quote, veterans of the government, you know that things change every once in a while. So there have been some more recent changes, and Charles asked to come and address those with you on travel pay. So Charles Fadden, our Chief of Transportation, is here to talk.
Hello, everyone. Can everyone hear me okay? Gene told me to speed it up because we were running behind, so I'll try and be as quick as I can. I only have the one slide. So national processing for travel pay is coming in sometime this year. As I stand before you today, that is really all that I know. So that could change next week, you know, the week after, who knows. But early around November or so, National took over our VISN, or our region, if you will, and thought that they could do a better job processing our claims than what we can. They could not. Our bar has been set very high here for our travel pay department. Our normal processing time is about 5 days, but when National took over, it was longer than 5 days. So we reached out to our VISN and asked them if we could have our claims back. Nothing is more frustrating than to see something you work hard at given over to someone else and then it falls apart. So we have control of our claims again. So please just be patient with us as we get those caught back up. Just in December, we processed about 4,000 claims as of Friday. This month, we were already over 3,000 claims. So we have definitely made a big improvement just in, you know, the short time that we took them back over. So we ask for your patience. If you have any questions, you can reach out to the travel pay department, which is their extension is right there. You can come by and see us. We're in building 1, just right as you come in the front door over by oncology. And then also I put a little screenshot on there as well. Your VA app health and benefits app. You can actually file your travel pay on there now. That is a really big thing. I don't know if you guys can see that online or not, but it'll actually show you how many days you have to file that claim, because as we know, 30 days from the date of the appointment, file your travel pay. But it will list the appointments you're eligible to file travel pay for, and it will give you the number of days you have left. No paper, no signature, just go on there and answer a few questions, go straight to our dashboard. We can process those extremely fast. Paper claims, if you come by the office, we have to scan those into a system, and then those get worked in the order that we receive them. So it takes a little bit longer, and that's where we got into the national processing. We were having to scan those into the system and then send those to a national folder, and then national would take those and they'd send them right back to us. What's the point of doing double work? So we, like I said, we got permission to take those back and not do that anymore. So any questions? Was that quick? Yes, sir. All right. Yes, sir.
How do you get that app?
You can come by our office and we can show you how to download that onto your cell phone. We also have a step-by-step guide that once you have it downloaded, it takes you through each step of the app and how to file that claim. We have a printout that we can give you to take home with you as well, but we can actually help you download that onto your phone. We did that quite a few times actually just yesterday. So just stop by our office and we can help you download it onto your phone and get you signed in.
Well, the staff that you have working there now, I mean, they're an A+ bunch of people.
They are A+, yes.
And every time I go there, we'll take care of it for you. Yes, sir.
Yes, they are a great staff. They do a great job. And so great. In fact, we have people that call us from, I can say the other names, Kansas City VA. Folks from there will call us and ask us to process their claims because they're not getting it done in a timely manner there, or Eastern Kansas. We do Columbia. So we get a lot of phone calls, a lot of emails from veterans at other sites within our region. And if we can help them, we help them. So that's our philosophy on it in our department.
Well, you need to give them a pat on the back because they're doing an excellent job.
Well, thank you. We appreciate that. And I hope they are probably online and just heard that themselves. You guys are A+.
You can do it on the website too, right?
Yes, VA.gov, and that is up there as well. Any other questions? No? All right. Thank you.
Thanks, Charles. We're going to run a little bit over. We're going to try to keep it on time, but as most of you know, we have multiple construction projects taking place around this facility, and Nick Howard is kind of our resident construction expert, and so he's going to talk to you about some of the different projects that are going on currently.
Good morning, everyone. My name's Nick. I'm the Chief of Projects, your Deputy Chief Engineer. Next slide, please. So I'm gonna just run through the pictures. I'll let you guys do the reading. This top left picture is actually just on the other side of our historic corridor. If you peek out through the windows, for those that are here local and on station, you'll be able to see what's going on out there. We're building the foundation currently, and it'll start to come out of the ground real quick over the next couple of weeks. That project is our endoscopy project. It adds 3 floors and about 15,000 square feet, adding more endoscopy space, improving our IT infrastructure and our biomed infrastructure. The next picture over is just the further end to the west of that same space. The bottom picture is over here to our northeast side of the campus, which is building 60. It's our CLC. It's quite an expansion there. It's about 18,000 square feet, if I remember correctly. So very exciting. It'll bring all new private patient rooms to our CLC. Next slide, please. This is our canteen and retail store with our partners from DCS. So very excited to get that opened. They started placing furniture this week, and we are working with our partners there at VCS to get that activated It'll likely won't open to the public till about the beginning of March. They've got to get all their supplies and everything to be able to start serving. So soon. Next slide, please. And then we have a lot of infrastructure projects, what we refer to as our non-recurring maintenance. This is how we improve the facility without adding space. Lots of infrastructure, boiler plant, chiller plant, emergency power plant, really adds to our resiliency as a facility. Should we ever in a power outage or anything like that, we'll still continue to give care here at the facility. And then we're also providing a lot of new improvements with our biomedical team by adding new equipment and replacing old equipment, gamma camera, fluoroscopy, a new PET CT coming soon, cath labs, digital radiology. So a lot going on there. And we're also improving the fire alarm infrastructure with the complete renovation of the whole system there for the whole campus. Next slide, please. Okay. I know that was a lot of information. We have a lot of construction going on. At $250 million worth. So we've had a lot of investment from not only our regional partners, but also the national partners. My name is again Nick Howard. If you have any questions, please feel to reach out to me. My extension is 58005 here at the campus. I'd be happy to answer them. Yes, sir.
Nick, can you tell me, is there any plan going on to improve the parking situation? I assume that falls under your jurisdiction.
It does. We did have a plan to renovate the entire south end of this campus, from a part of the campus. Unfortunately, the contractor that bid on it was significantly higher than what we had budgeted. So we've had to kind of go back to the drawing board to kind of revamp that project and come up with a new scope that will get us within budget. So more to come very soon. We do have a project that will address the northwest side of campus, not parking that's over there by the emergency department. That is coming in, I think FY 27. Yes, ma'am.
It was brought up at the departmental Kansas meeting for the VFW in Junction City about the flag. And I believe it's on the highway side. That at some point it had to come in disrepair. And they said that flag cost $10,000. And so the VFW was going to approach the VA and see if there's any way that we can help defray some of the costs. I didn't know if we've heard anything yet.
I have not heard anything about that. I do know that a flag does not cost that much. We do replace them periodically just because they do go through so much wear and tear in this Kansas weather. We'd be happy to discuss anything like that. They'll reach out to our engineering department and we can take that up.
Well, it sure looks good out there on that yard, I'll tell you for sure.
Yes, it's quite the flag. Sorry, thank you.
Thanks, Nick. Appreciate that. Lastly, but definitely not least, our whole health program has been a focus of the VA for a number of years. And looking at whole health, it takes into account the whole of you as a veteran when it comes to creating treatment plans and things like that. So Janelle Johnson is here today to talk to you about health coaches through our whole health program and how that might benefit you as a veteran developing a health plan. So Janelle.
Hello. Can everybody hear me? Okay. And you read my mind. You took my line. I was going to say last, but certainly, yeah, the last person to speak, but not the least. The whole health system of care here at the VA, you notice it's called a system of care. It's a mandated directive from the national level down and has been for some years now. And has been rolled out to VAs throughout the country, again, as a mandated directive. I would say that here in Wichita, we are definitely in the game and ahead of the game in so many ways. We have a lot of services. But specifically, I'm going to speak to you about health coaching, which is a collaboration between the coach and the veteran. And so as you can see on this slide, it tells you the role of what we do as a coach and then your role as a veteran. So as a coach, we facilitate or guide a very specialized process that allows for you, the veteran, to come up with a personal health plan in an area or areas of life that you deem important and that you're ready to make changes in. As a coach, we hold space for you to come up with that plan. We actively listen. We are present for you. And probably most significantly, what we do is we honor and support what's most important to you in coming up with that personal health plan. As the veteran, you are in the driver's seat of this process because you are the expert on your life's journey. And so with that being said, in coaching sessions, like initially, you come in, you fill out a personal health inventory, which allows you to look at every area of your life in a comprehensive way and self-assess where you are and where you want to be in each of those areas. Additionally, in coaching sessions, we're identifying those areas of strength and areas for improvement. Not only that, but then also identifying your individual strengths so that you can tap into those strengths to accomplish the health goals that you have for yourself. In ongoing sessions, the initial sessions, we explore the big picture of your life, the things that matter most to you. The VA has come up with an acronym that is called the MAP: your mission, your aspirations, your purpose. And so that is discussed in ongoing sessions because we're always linking your health goals to what's motivating you, what's empowering you, what's driving you to accomplish those goals for that goal. And so, we're at the next slide already. Again, the MAP is really the foundational piece of whole health in general and in the health coaching process, because it's basically what drives you in life. So what's driving you to improve your health? Come up with a personal health. And so we go to the next slide. I need to pick up the pace here a little bit, right? I just want to show you a visual depiction of the circle of health. And so when the PHI is conducted in the health coaching session, you're taking a walk through the circle of your life, circle of health. And you're looking at those areas that are comprehensive, like nutrition, like movement or exercise, mentally and emotional well-being, surroundings, relationships, personal and professional development, and you're assessing where you're at and where you want to be. And so this is the PHI is a great tool, a very valuable tool in helping you set goals and accomplish them. And not only that, I just want to mention real quickly that in the coaching sessions, we make sure that your goals are SMART goals and they meet the criteria of being specific and strategic measurable, action, behavior oriented, and reachable. And then also putting a time frame on for when you want to accomplish the personal health goals that you have for yourself. And so the final slide, I just want to give kind of a brief testimony from a veteran who engaged health coaching. And this was an Air Force veteran who lost 115 pounds. And as he put it, he gained a whole new life in the process. His initial introduction to whole health was in group studies, mindfulness classes, and Tai Chi classes. But it wasn't until he connected with a nationally board certified health coach that he was able to realize the full benefit of the whole health system of care. And so the results that he got, again, were significant weight loss. He also, his blood pressure and his glucose levels went down. And he was also able to taper down on the medications that he was taking. And this is because he continued to engage his medical and clinical care. That's still very important. But he also came up with a personal health plan in the area of nutrition and exercise to accompany his medical and clinical treatments. So truly, this is a success story. And it's testimony that you, veterans out there, can accomplish your health goals and live a fuller life. Be wholly and fully healthy. So, any questions? And I have kind of speed through the end there, but any questions on health coaching? And once again, it's one of many services that we have that fall into a whole health system of care. Thank you. Mhm.
Thanks, Janelle. Appreciate that information. That brings us to our question and answer portion. I believe Jeff has been following along on chat. Are there any questions in the chat that need to be addressed? Jeff says no. So any questions from the audience? First of all, I guess I should go back and say thank you to those who presented today and those who are still here. So if anyone has a question that they would like to ask any of those that presented today, feel free now. Yes, sir.
99% of what I get done here, I'm very happy with. People are great. They smile at you. They offer help when you're walking down the hallways, etc. However, I've had a problem with one person here, and I tried to solve it through the complaint. I don't know who I called, but I ended up calling his supervisor, and his supervisor said most people like him. Well, first of all, I'm on Medicare and VA, and I don't think they have unlimited funds. I like to protect those dollars. This person, without dirtying too much of your laundry here, was basically ain't doing his job. And that really irritated me. He's just going to sit here for 20 years, collect his pension and leave. And that upsets me. So I called the regular complaint office. And when I found out, hey, then his supervisor got mad at me and said, well, some people like him. And he was going to send me to an outside vendor. And then I said I didn't go the right direction here. So I went to the complaint line here. And they sent me to an outside vendor to do the same thing. And that's wasted money as far as I was concerned. And I think they're just doing it to appease me. This guy will still be sitting here at the VA, still doing a poor job. And to start out with, when I showed up, he was wearing a rain suit and had paint all over it. He wasn't dressed very professionally for working here. Well, I cut him some slack on that. Thought he might be doing some painting in the back room here and doing things. The next time I came back, 2 weeks later, same paint, same marine suit. But then the quality of his product was, the quality of his care was not there. And that really upset me. And I think people are covering for him. And I think they sent me an outside vendor to appease me. That don't appease me. Saving my dollars at the VA and in Medicare is what appeases me. So I don't think I got and I don't know who to go to say, hey, what's going on here?
Okay,
And I don't want to try to get this guy fired. I just want him supervised. I want him doing his work right. And I said, hey, in the military, I've seen this. A guy will cover for his buddy so he doesn't get in trouble. But that doesn't solve the problem. That just exacerbates the problem. So anyway, I just don't know where to go from there.
okay.
I'm still left with questions in my head.
Thanks for bringing that to our attention.
You're welcome.
I think having brought it to our attention while Mr. Payne is sitting here is probably not a bad thing.
Okay.
We do have the Veterans Experience Office that would be my suggestion.
That's who I think I talked to the second time.
Okay,
And I think that's what got me transferred to an outside vendor rather than solving the problem internally here. They sent me an outside vendor thinking, oh, he'll be happy and he'll go home. Well, I'm not happy. I'm happy with the outside vendor, but I'm not happy with my original complaint. Didn't get carried through.
okay. The other opportunity, Mr. Payne's here.
Okay.
But in order to get in touch with Mr. Payne, you have to speak to the director for him. So there are locations around the hospital that have kind of a poster board that says, speak to the director. It has an insert in it that you can fill out and put it in that. That's an anonymous method of providing information to Mr. Payne or.
I don't want to be anonymous. I just want to get a handle.
You can put your name on it, or you don't have to put your name. You can also access that through the VA website, from the Dole VA website.
Okay.
There is a section there for speak to the director, so you can submit that to Mr. Payne that way as well.
I'll also speak with you after this, sir. That's okay.
He what?
I'll speak with you right after this.
Okay. Then one other question I got is I filed some claims and I went through the American Legion area. Does that still exist? Now that the PAC Act came out, do you still go through the American Legion or the VFW?
Yes.
Yeah.
That's a option, but not.
Yeah, the American Legion has an office in building 61, I'm sorry.
That's the other problem. I get told what building to go to and I ain't found a number on any of these buildings yet.
Yeah, building 61 is basically almost opposite of here. So
Yeah.
over on the northwest side. But there is an American Legion office there.
Okay.
Thanks for bringing
You
this.
go down to the north side.
Northwest side where
Okay.
the Circle Drive is, the by the entrance on
Yeah.
the north side.
Okay.
Just inside.
Thank you.
Any other questions? Comments? Okay, so next slide, please. This was recorded, as I said, there will be information on the website either later today or tomorrow. You can always contact us at the email here. That goes to our communication service team, and we will address any concerns or questions that you had today. And we can get the subject matter expert to answer questions as well. So this is just a nice way to be able to kind of consolidate a question to a specific place that then we'll distribute out. But with that, again, thanks for coming in today. We will hold this again in this facility at quarter. Now, we don't have the specific date yet, but it'll be sometime in April. And we would encourage you to encourage your veteran friends to come and join us. It's kind of my fault for this having gone longer than what we expected to. I wondered if we could get more questions in person. So I tried to kind of dial back the amount of content. We will look at how this works, but we will try to get you out by noon in 1 hour the next time. So thanks again. Appreciate everybody coming today. You have a great rest of the week. Thanks. And I apologize. I meant to say one more thing. Mr. Duncan will provide me some information about an airborne hazards and burn pits PAC Act meeting that's going to take place tomorrow. If you would like to have If you have any questions and would like to know more, please see Mr. Duncan right over here in the baby. Thanks.